Well, I'm standing here holding some yogurt, some beautiful acidophilus yogurt, and also, so I've gone out to my garden and picked some kale. Now, I also have spinach growing in my garden, but I want to talk to you about calcium in this post. And what we want to do is we want to have 1,200 milligrams a day of calcium. I'm Dr. Wendy Sweet from My Menopause Transformation. My focus is on lifestyle science and the lifestyle evidence. I've just come off Zoom calls with practitioners from around the world, America, Canada, the UK, certainly Australia, New Zealand, Malaysia, Singapore. And what these practitioners are telling me is that women are confused. They're really confused about how to look after themselves. There's so much information out there about perimenopause, menopause, and postmenopause. But what we have to do as women coming through this stage of life is firstly we have to understand that our reproductive hormones are changing. No matter if you're discussing HRT or you're on HRT with your doctor, that's between you and your doctor. But what else can we be doing to change our lifestyle? And this is where the confusion comes in. But what we want to do, so one of the things we need to do is we need to look after our heart health. I cannot emphasize that enough. Menopause changes the heart, the size of the heart muscle, and also the contractility of the muscle. And what we need is we need calcium, 1,200 milligrams a day. So I want you to think about where you're getting your calcium-rich foods from. Yes, I have a little bit of yogurt. Yes, I have a little bit of cheese. I know how important calcium is, certainly because I do exercise. As you know, it's still the ski season, and I'm skiing and hiking and biking and doing a little bit of weight training, not as much as being promoted, because it can really upset if you're doing too much exercise, then that can be detrimental to your hot flushes, to your brain fog and other symptoms. So what we want to do is we want to take a sensible approach to lifestyle, and we want to not do these extremes of everything that's out there. And one of these sensible approaches is to understand that as you come through menopause, which is I call the bookend to puberty, I coined that phrase 10 years ago, and what it is that your body internally is starting to change. No matter if you're on hormone replacement therapy or supplements, your organs are aging. The academic and lifestyle science information shows that there are a number of changes around the body as we come through the menopause transition. And we've seen this from our mother's generation. So what we want to do is we want to find ways to slow down the rate of aging. We can't prevent it. We all want to look youthful, but we cannot prevent the rate of aging. And what we want to do is have more energy and vitality as we come through. And this really means looking after the heart. It's a muscle. It relies on calcium. And what calcium does is it helps the nerves move through the heart wall, and it also helps the heart to beat, the contractions. So if you are doing a lot of exercise, then how well are you looking after your heart? How well are you looking after your calcium levels and everything else? We also need our calcium for muscles. It often gets talked about just in terms of our bone health, and that's really important. But your muscles are using calcium to contract. Calcium helps the nerve jump into the muscle, so we need it for muscle contraction. And the other thing that calcium does is it relies on vitamin D. And that's why in all of my posts and in all of my programs, I'm trying to get women to get their vitamin D tested if they can, because it's so important for the absorption of calcium in the small intestine. And if you've got gut health problems, then come on board with me. If you're not sleeping, we need calcium for sleep to slow down the brain waves and to improve the nervous system. So I really want you to think about the programs that I've got on offer. I've got Circuit Breaker if you're thinner and leaner. because I've got more phytoestrogens in those programs. If you are overweight or obese, get into the Transform Me program. It's my weight loss program. It's getting lots of results for women around the world because I actually move them off too much estrogen-rich foods and really help them understand the foods that matter, the kale, the types of foods that are really going to help their fat metabolism. It's not about doing a lot of exercise when you're overweight. It's actually about sleep, and it's about liver and gut health. So come on board into that one. If you are over the age of 55 or 60, as I am, and you're in postmenopause, then check out the new Beyond Menopause program, because it's really important. In those programs, I've got food guides, and really important for you to understand the types of foods that you need. It's not about your family, it's about you, and having, really focused on the lifestyle solutions that you need in so many ways. So what I like about kale is that it's low in oxalates compared to spinach. So spinach can actually be a little bit detrimental for calcium absorption. So I wilt mine with a bit of olive oil, but when I'm really focused on calcium intake, I choose kale or bok choy or broccoli. So those are the foods that are low in oxalates, and oxalates actually bind calcium and they prevent their absorption. So we've got to be a little bit careful about what we have. We do know that soy is high in calcium, and that's a big part of a lot of Asian culture, and a lot of emphasis has been put on soy for midlife women. But if you're overweight or obese, then I don't have as much soy for you, because your fat cells are making estrogen, and of course soy is really high in estrogenic compounds. So what we need to do is we need to think about calcium. I'm focused on that in my coaching groups this week. I've got education ones for the practitioners, and I've got my main coaching group for women who join me on my programs. That's where they get me, and I answer their questions, help them to problem solve, and draw their attention to really looking after themselves. We're so busy, there's so much stress, but we have to look after ourselves now in our midlife years, so that we can step into our healthy aging years ahead. As I said, I'm Dr. Wendy Sweet from My Menopause Transformation, and the doctor part is not a medical doctor, it's a PhD doctor, and I'm really focused on lifestyle solutions. My master's qualification was in lifestyle behavior change. I'm a former registered nurse, and I've also got a degree in physical education. So lots to offer you. I want to share this amazing knowledge that I've been accumulating for so long with you. So jump to the website, do the symptoms quiz, listen to the masterclass, and come on board if you're struggling. I really want to help you turn that around.